My distinguished guest today is Dr. Houman Hemmati, co-founder and chief medical officer at Optigo Biotherapeutics. And Dr. Hemmati actually joined us about a year and a half ago on the podcast, giving us an update on the work that they're doing in retinal medicine. And at that time, you explained to us that what you're doing is taking the best performing intravitreal drugs and trying not to improve the efficacy of the drug, but rather keep the duration, extend that to be longer. So thanks for dropping in and giving us another update.
Yeah, Carey, thanks so much for the invitation to chat. And since we last spoke, we've made a tremendous amount of progress at Optigo. And like you mentioned, we've taken aflibercept, which is the parent molecule of Eylea, and created new molecules based on aflibercept, which are bispecifics. One end still binds to VEGF, the protein that causes neovascularization in the retina, in wet AMD, and diabetic retinopathy, etc. And we've created the other end that binds to different components of the vitreous, different proteins such as hyaluronic acid or albumin or type 2 collagen. Back then, this was a lot of aspirational work, and we were working on creating those molecules, validating those molecules, purifying them, etc. And since that time, I'm very proud to say that we've made enormous progress and have a lot to share today.
Awesome. Congratulations.
Thank you.
Let's talk about what data have you generated?
Yeah, so the first thing we did is created a panel of molecules that are bispecifics that bind to each of those three targets at different affinities, the weak, medium, and strong affinities, and tested them in pharmacokinetic models, injected them into rabbit eyes, and tested at different points in time compared to regular Eylea or aflibercept, how long they stay in the eye, right, to measure pharmacokinetics or intravitreal residence time. And what we found was that our best performing molecules actually were able to extend the half-life by over 4 times compared to Eylea and increase the area under the curve, so the total exposure by about 7-fold compared to Eylea, something that I think exceeded even what our own intent was when we began this program.
Wow, that is incredible. So let's talk about what would that mean for patients in terms of their injection schedule?
I'm glad you asked about injection frequency, because in order to determine that, we needed to show that the efficacy matches the pharmacokinetics. So we did a second experiment, which is a rabbit VEGF model, injected VEGF into rabbit eyes alongside our drugs, and we had a control of Eylea as well, and we wanted to see how long does the VEGF, anti-VEGF activity of aflibercept bispecifics with our molecules last compared to the regular molecule. And once again, we saw a mirror image of the same pharmacokinetic curve, approximately 4-fold increase in half-life. What does that translate to in humans? Using all of our pharmacokinetics modeling, that means injection frequency every 6 months or more. Could be as long as 9 months following each injection. And that, for patients, as you know, is a game changer. And by the way, this is compared to 2 milligram Eylea, regular Eylea. This is not even in comparison to the 8 milligram Eylea HD, which would presumably give an even more favorable pharmacokinetic profile.
So what's next? What are you working on leading into 2025?
Yeah, 2025 is going to be an exciting year for Optigo because we're doing a few things. Right now, we're in the process of doing final purification of our lead molecules. Now that we've selected what the leads are, we're purifying them in larger quantities. And then we're initiating in the first quarter of 2025 NHP studies. So we'll have monkey data in order to really demonstrate everything we already have, plus safety at higher concentrations, longer duration. And I think that's the gold standard, as you know, for any intravitreal, any retinal product, is doing that at the clinical concentrations and showing that it's safe and effective. And we're excited about what we're going to show soon.
Very good. So what do you think in terms of how long it might take to get this into the hands of clinicians?
Well, in order to get an FDA approval, it's a longer path, obviously. So once we do that, we meet with the FDA, we get alignment on all the studies we need to do, the GLP tox studies, in order to get into the clinic, do a phase 1-2 study, and we're preparing those already, as you can imagine. So just in anticipation of getting good FDA feedback. Once that's ready, we're ready to go in the clinic, and I think that's something that can happen within the next couple of years.
So finally, the big question, fundraising. It's been a rough couple years out there for fundraising in the space. So are you in a raise right now? Are you looking to raise funds?
Yes. So right now we're initiating a raise somewhere around $30 to $35 million that would get us not just to an IND, but through our first in human study and then some. At the same time, obviously, we're speaking with a handful of different strategic partners who have an interest in this because it really does address one of the biggest unmet needs in retinal therapeutics today.
Well, congratulations. It sounds like you've just made tremendous progress since the last time we sat down together.
Thank you so much, Carey. Appreciate it.